Let's talk about how to really get some leverage out of this. This is something I learned from Dr. Spear, from Frank Spear, and I want to give him credit because he's the one that taught me this, and it is invaluable. When you have the photos loaded on the tablet, imagine that you're the patient, Naren, and I'm the new patient coordinator or the dental assistant. I might say something like this. Naren, you might remember earlier in your appointment today when I took those photos. Do you remember those?
Yes.
Well, I uploaded them here to the tablet so you can take a look at it. Now I hand you the tablet. And Naren, as you're looking at the photos, the tablet works just like your smartphone. If you want to take your finger and flick it, that'll go to the next photo. And if you want to pause and zoom in, you can take your fingers and pinch out, and you can zoom in to infinity, just like your smartphone. Now, what I'm going to do next is very theatric. It doesn't need to be done, but it has a very specific purpose and it should be done. Make an excuse to leave the room and allow the patient to view their photos for 2 or 3 minutes with no one looking over their shoulders. So I'm going to say, Naren, doctor and I need to take a look at your digital radiographs. While we're doing that, would you do me a favor and look through these photos? Make a mental note of any questions you have. And when doctor and I come back in the room, we'll be happy to answer any questions you have. We'll be right back. And we leave the patient alone. 2 minutes, 3 minutes at the most. What do you think happens, Naren, as we left them alone? No one else is in the room with their phone. They've never seen their teeth like this. Their curiosity level is at a peak. They're going to be highly engaged in these photos. Wouldn't you agree?
Absolutely. I think, again, I bring this back to psychology. Dr. Cialdini said, we are committed to our own decisions more so than we are committed to other people's recommendations. So when I go through the photos and let's say I see, certain things about my teeth, I want that fixed because I want it, but not because somebody else told me I need to do that, right? So it's a much higher level of, commitment towards that decision or that inkling to do something about it. So
well,
I
exactly.
think it's very powerful.
What happens when you and the doctor come back in, the patient is typically asking you a lot of questions. Oh, doc, what's this? Oh, what's that? I didn't realize my lower teeth were so crowded.
Mm-hmm.
They're simply firing questions at you on all the things they learned when they looked at these photos, which you remember, Naren, when I said Dr. Spear had 2 recommendations to accelerate your practice. One was to use these digital photos for patient education.
Yes, and the other one was present confidently.
Confidently. Well, here is that piece. Many dentists have trouble presenting options to patient if they don't know if the patient has any interest, especially when it comes to elective treatment. If it's disease, that's no problem. We have an obligation to tell them what's going on. But if we don't know, if they have a space between their teeth and we don't know if a patient has any interest in that, many dentists will shy away from pointing it out because they don't want to be critical and they don't want to make the patient feel bad. But when the patient says, doc, I didn't realize that space between my teeth was so wide, they're teeing it up for you on a 16-inch softball.
Yes.
You can say, does that concern you? They say, now that I see it like this, it sure does. And it allows you to present confidently because they're asking for your help. They're asking you what's going on. And really, in a subconscious way, they're saying, how can this be fixed? I mean, imagine the patient that says, doc, and this is common. What I'm about to say is really common. Doc, I didn't realize that my lower teeth were so crowded until I saw that one photo. And we're talking about the lower occlusal view. That's like the helicopter hovering above their mouth, doing an aerial shot of the lower teeth. I didn't realize they were so crowded. Mm-hmm. Naren, does that bother you?
Yes, absolutely. Yeah. And now that I can see it, I definitely want to do something.
And now I think you'll present confidently because, any dentist is confident when the patient has a question for him, very, very confident. Well, 6 photos for patient education. I want to encourage all of you to do this as quickly as possible in your practice. The photos can be taken in 3 minutes. Now, it may take you a little bit of time to go over those photos with your patient. You may want to extend your new patient appointment time just a little bit, maybe 10 minutes initially, so that you have a chance to review those photos. But I think you're going to find this has an incredible benefit in your practice. And you can start this very quickly. It's likely that you have most of the equipment. You probably have a camera. You probably have the retractors, the mouth mirrors. Get started right away and watch what happens in your practice.